Interstitial cystitis, often called IC, is a chronic condition causing bladder pressure, pain, and sometimes pelvic discomfort. It can significantly impact daily life, making even simple activities challenging. Many people with IC find that certain lifestyle changes can help manage symptoms and improve their quality of life. In this video, we'll explore the most effective lifestyle modifications for IC, ranked by their impact, so you can make informed choices about your health and well-being. Let's start by understanding what IC is and why lifestyle adjustments matter so much for those living with this condition. Lifestyle changes are often the first line of defense for managing interstitial cystitis. Unlike medications, which can have side effects, lifestyle modifications are generally safe and can be tailored to each individual's needs. By understanding which changes have the most impact, you can focus your efforts where they matter most. In the following scenes, we'll rank these changes based on their effectiveness, starting with the most impactful. Let's dive into the top lifestyle adjustment for IC relief. For most people with interstitial cystitis, dietary changes have the greatest impact on symptom relief. Certain foods and drinks can trigger bladder irritation, leading to pain and discomfort. Common culprits include caffeine, alcohol, spicy foods, citrus fruits, and artificial sweeteners. By identifying and avoiding your personal triggers, you can often see a dramatic improvement in symptoms. Keeping a food diary can help you track which foods worsen your IC and which are safe. This process may take time, but it's often the single most effective lifestyle change for managing IC. Staying well hydrated is crucial for bladder health, but it's important to strike the right balance. Drinking too little can concentrate urine and irritate the bladder, while drinking too much may increase urgency and frequency. Most experts recommend sipping water throughout the day rather than drinking large amounts at once. Avoiding carbonated drinks and those with artificial sweeteners can also help. Proper hydration supports overall bladder function and can reduce the severity of IC symptoms. Bladder training is a behavioral technique that can help reduce urgency and frequency in people with IC. The goal is to gradually increase the time between bathroom visits, retraining your bladder to hold more urine comfortably. Start by tracking your current bathroom schedule, then slowly extend the intervals between trips. This process requires patience and consistency, but over time, many people experience fewer symptoms and greater control over their bladder. Stress is a well-known trigger for interstitial cystitis flare-ups. Learning to manage stress through relaxation techniques can make a significant difference in symptom control. Practices such as deep breathing, meditation, yoga, or gentle stretching can help calm the nervous system and reduce bladder sensitivity. Regular stress management not only improves IC symptoms but also enhances overall well-being, making it a key lifestyle change for those with IC. Pelvic floor physical therapy is a specialized treatment that can help relieve IC symptoms, especially if pelvic muscle tension is a contributing factor. A trained therapist can teach you exercises to relax and strengthen the pelvic floor muscles, improving bladder control and reducing pain. This approach is particularly helpful for those who experience pelvic pain or muscle spasms along with their IC. Consistent therapy sessions can lead to lasting improvements in comfort and function. Regular gentle exercise, such as walking, swimming, or stretching, can help manage IC symptoms by improving circulation, reducing stress, and supporting overall health. High-impact or strenuous activities may worsen symptoms for some people, so it's important to choose exercises that feel comfortable and do not trigger pain. Listen to your body and aim for consistency rather than intensity. Over time, gentle movement can contribute to better bladder health and improved quality of life. Beyond food and drink, other substances can irritate the bladder and worsen IC symptoms. These include certain medications, personal care products with fragrances or harsh chemicals, and even some laundry detergents. It's important to read labels carefully and choose products that are free from potential irritants. Making these small changes in your daily routine can help minimize exposure to triggers and keep your bladder as comfortable as possible. Tight clothing, especially around the waist and pelvis, can put extra pressure on the bladder and worsen IC symptoms. Opt for loose, breathable fabrics that allow for comfort and freedom of movement. This simple change can make a noticeable difference in daily comfort, especially during flare-ups. Prioritizing comfort in your wardrobe is an easy yet effective way to support bladder health. Quality sleep is essential for healing and overall well-being, but IC symptoms can make restful nights difficult. Establishing a consistent sleep routine, going to bed, and waking up at the same time each day can help regulate your body's natural rhythms. Creating a calming bedtime environment, avoiding screens before bed, and practicing relaxation techniques can all contribute to better sleep. Improved rest can, in turn, help your body cope with IC symptoms more effectively. Keeping a detailed record of your symptoms, diet, activities, and stress levels can help you identify patterns and triggers for IC flare-ups. Use a journal or a smartphone app to log daily experiences. Over time, this information can guide you in making more effective lifestyle choices and communicating clearly with your healthcare provider. Tracking empowers you to take an active role in managing your condition. Living with interstitial cystitis can feel isolating, but connecting with others who understand your experience can make a big difference. Support groups, whether in person or online, provide a space to share tips, encouragement, and emotional support. Building a network of understanding friends, family, and fellow IC patients can help you feel less alone and more empowered to manage your condition. Open communication with your healthcare team is essential for effective IC management. Share your symptom diary, discuss what lifestyle changes you've tried, and ask questions about new strategies. Your provider can help tailor recommendations to your unique needs and may suggest additional therapies if lifestyle changes alone aren't enough. Remember, you are an important partner in your own care. Despite your best efforts, flare-ups can still happen. Having a plan in place can help you cope more effectively. This might include using heat packs, practicing relaxation techniques, or temporarily adjusting your diet. Knowing your personal triggers and early warning signs allows you to take action quickly, potentially reducing the severity and duration of a flare. Caffeine and alcohol are two of the most common bladder irritants for people with IC. Both can increase urgency, frequency, and discomfort. Limiting or eliminating these substances from your diet can lead to noticeable improvements in symptoms. If you're used to having coffee or alcoholic beverages daily, try gradually reducing your intake and replacing them with bladder-friendly alternatives like herbal tea or water. Artificial sweeteners, such as aspartame and saccharin, are known to trigger IC symptoms in many people. These additives are found in diet sodas, sugar-free gum, and many processed foods. Reading ingredient labels and choosing natural sweeteners or unsweetened options can help you avoid unnecessary bladder irritation. This small change can make a big difference for sensitive bladders. Not all foods are problematic for people with IC. Many find that bland, low-acid foods such as rice, potatoes, lean meats, and certain vegetables are well tolerated. Experimenting with different foods and noting your body's response can help you build a personalized, bladder-friendly diet. Remember, everyone's triggers are different, so what works for one person may not work for another. Spicy and acidic foods, such as hot peppers, tomatoes, and citrus fruits, are common triggers for IC symptoms. These foods can irritate the bladder lining and lead to increased pain or urgency. By minimizing or avoiding these items, you may notice a significant reduction in discomfort. Focus on gentle, soothing foods that support bladder health. When you drink, fluids can be just as important as how much you drink. Some people with IC find it helpful to limit fluid intake in the evening to reduce nighttime bathroom trips. Spreading fluids evenly throughout the day and avoiding large amounts at once can also help minimize urgency and frequency. Adjusting your drinking schedule is a simple way to support better bladder control. Applying heat to the lower abdomen or pelvic area can provide soothing relief during IC flare-ups. Heat packs, warm baths, or heating pads help relax muscles and reduce pain. Always use heat therapy safely to avoid burns, and never apply heat directly to the skin. This simple home remedy is a favorite among many IC patients for its comfort and effectiveness. Mindfulness practices, such as meditation and deep breathing, can help reduce stress and improve your response to IC symptoms. By focusing on the present moment and letting go of worries, you can create a sense of calm and resilience. Mindfulness is a valuable tool for managing both the physical and emotional challenges of living with IC. Gentle yoga can be especially beneficial for people with IC. It combines movement, stretching, and relaxation, all of which support bladder health and stress reduction. Choose poses that are comfortable and avoid any that put pressure on the pelvic area. Practicing yoga regularly can help you feel more in tune with your body and better equipped to manage symptoms. Smoking and exposure to secondhand smoke can irritate the bladder and worsen IC symptoms. Quitting smoking is one of the best things you can do for your overall health, and it may also help reduce bladder discomfort. If you need support to quit, talk to your healthcare provider or join a smoking cessation program. Carrying excess weight can put additional pressure on the bladder and pelvic area, potentially worsening IC symptoms. Maintaining a healthy weight through balanced eating and regular physical activity can help reduce this pressure and support overall bladder health. Even small changes in weight can make a noticeable difference in comfort and symptom control. Some people with IC find that foods high in potassium, such as bananas, oranges, and tomatoes, can trigger symptoms. If you notice a pattern, try limiting these foods and see if your symptoms improve. Always consult with your healthcare provider before making significant dietary changes, especially if you have other health conditions. Some supplements, such as calcium glycerophosphate, Prolief, may help neutralize bladder irritants in food and reduce symptoms. Always talk to your healthcare provider before starting any new supplement, as not all are safe or effective for everyone. Supplements can be a helpful addition to other lifestyle changes for some people with IC. Developing healthy bathroom habits can help manage IC symptoms. Avoid holding urine for too long, as this can increase bladder pressure and discomfort. On the other hand, try not to go just in case too often, as this can train your bladder to hold less. Find a balance that works for you and supports bladder health. During flare-ups or when symptoms are unpredictable, using protective products such as absorbent pads or bladder-friendly underwear can provide peace of mind. These products are designed for comfort and discretion, allowing you to go about your day with confidence. Choose options that are gentle on the skin and free from harsh chemicals. IC can make socializing challenging, but with some planning, you can still enjoy time with friends and family. Choose venues with easy bathroom access, bring your own bladder-friendly snacks, and communicate your needs to those around you. Adapting your social life helps you stay connected while managing your symptoms. Balancing work and daily tasks with IC can be tough, but small adjustments can make a big difference. Consider flexible work hours, remote work options, or taking regular breaks as needed. Communicate with your employer or colleagues about your condition if you feel comfortable. Prioritizing your health helps you stay productive and reduces stress. Traveling can be daunting for people with IC, but with preparation, it's possible to enjoy trips and vacations. Plan your route with bathroom stops in mind, pack bladder-friendly snacks and drinks, and bring any medications or comfort items you may need. Inform travel companions about your needs so they can support you along the way. Managing IC is a journey, and progress may be gradual. Set realistic expectations for yourself and celebrate small victories along the way. Not every day will be perfect, but each positive change you make brings you closer to better symptom control. Be patient with yourself and recognize your efforts. Knowledge is power when it comes to managing a chronic condition like IC. Take time to learn about your diagnosis, treatment options, and the latest research. Reliable sources include healthcare providers, reputable websites, and patient organizations. The more you know, the better equipped you'll be to make informed decisions about your care. Advocating for yourself is an important part of living with IC. Whether it's requesting accommodations at work, seeking support from loved ones, or discussing treatment options with your doctor, don't hesitate to speak up for what you need. Your voice matters, and advocating for yourself can lead to better outcomes and greater confidence. Some people with IC find relief through complementary therapies such as acupuncture, massage, or herbal remedies. While evidence for these approaches varies, they may provide additional comfort and support when used alongside conventional treatments. Always consult your healthcare provider before starting any new therapy to ensure it's safe for you. Maintaining a positive outlook can be challenging with a chronic condition, but hope is a powerful tool. Focus on what you can control, celebrate progress, and seek joy in everyday moments. Connecting with others who understand your journey can also help you stay motivated and optimistic about the future. IC can affect intimacy and relationships, but open communication and flexibility can help. Talk with your partner about your needs and comfort levels, and explore new ways to connect that don't cause pain or discomfort. Intimacy is about more than physical contact. It's about understanding, support, and closeness. During times of discomfort, distraction techniques such as listening to music, reading, or engaging in a hobby can help shift your focus away from symptoms. Finding enjoyable activities that occupy your mind can make challenging moments more manageable and improve your overall mood. Every step you take toward managing IC is worth celebrating. Whether it's identifying a new trigger, finding a helpful routine, or simply having a good day, acknowledge your progress. Celebrating small victories helps build confidence and keeps you motivated on your journey to better health. Let's quickly review the most impactful lifestyle changes for interstitial cystitis. Dietary modifications, hydration, bladder training, stress management, and pelvic floor therapy top the list. Each of these changes can make a significant difference in symptom control. Remember, the best approach is often a combination of strategies tailored to your unique needs. No two people with IC are exactly alike, so it's important to personalize your management plan. Experiment with different lifestyle changes, track your results, and adjust as needed. Work closely with your healthcare provider to create a plan that fits your life and supports your goals. Your journey is unique, and your plan should be too. While lifestyle changes can be highly effective, there are times when medical intervention is necessary. If your symptoms are severe, worsening, or not responding to self-care, reach out to your healthcare provider. Early intervention can prevent complications and help you find the best treatment options for your situation. Consistency is key when it comes to managing IC. Lifestyle changes often take time to show results, so stick with your plan and be patient. Regularly review your strategies, celebrate your progress, and don't be discouraged by setbacks. Over time, your efforts will add up to meaningful improvements in your quality of life. Managing interstitial cystitis is a journey that requires patience, self-awareness, and a willingness to adapt. By focusing on the most impactful lifestyle changes like diet, hydration, stress management, and support, you can take control of your symptoms and improve your quality of life. Remember, you're not alone, and every positive step counts. Stay empowered, stay hopeful, and keep moving forward on your path to better health.